Good afternoon, and I want to thank each of you for being here today. Congressman, thank you for your presence. And over the past 24 hours, I've been in very close contact with the director of the CDC, Dr. Tom Frieden, as well as all the appropriate Texas state health officials. We're working very closely with the local, both the city and the county health officials as well in this very serious case as we partner. As you know, a patient was admitted to this hospital September the 28th, subsequently tested positive for Ebola. Today we learned that some school-aged children have been identified as having had contact with the patient and are now being monitored at home for any signs of the disease. I know that parents are being extremely concerned about that development, but let me assure these children have been identified and they are being monitored, and the disease cannot be transmitted before having any symptoms. I have full confidence in the medical professionals, in Superintendent Miles, in our local, our state, and our federal partners in keeping. This is a disease that is not airborne and is substantially more difficult to contract than the common cold. We have experts here with us today who will be talking to you in a minute about the precautions that you may want to take. The medical community of North Texas, along with officials from the state and federal government, have been working together to take every step available and necessary to care for this patient's health and to ensure the safety and welfare of our citizens. There are few places in the world better equipped to meet the challenge that is posed in this case. Texas is one of only 13 states certified by the CDC to conduct diagnostic Ebola testing. And we have the healthcare professionals and the institutions that are second to none. The public should have every confidence that the highly trained professionals involved here will succeed in this very important mission. Public health investigators from Dallas County and from the Texas Department of State Health Services are working to identify, to locate, and monitor the health of all of those who have come into close contact with the patient. The highly qualified men and women of Texas Health Presbyterian are doing everything in their power to deliver the very best care for this patient. They have been and they will continue to be in close contact with federal, state, and local officials to ensure the public safety. This case is serious. Rest assured that our system is working as it should. Professionals on every level of the chain of command know what to do to minimize this potential risk to the people of Texas and of this country for that matter. I'd like to ask Dr. David Lakey, he is the head of our state health services, to come and share with you the efforts that are ongoing as we address this issue. David?
Yes, sir. Well, good morning, everyone. My name is David Lakey. I'm the Commissioner of the Texas Department of State Health Services, and I really appreciate you being here today. I want to echo several of the comments that were made by the Governor. First, our thoughts and prayers are really with the family. They were notified about their loved one having Ebola yesterday. Obviously, is a scary diagnosis, and so our thoughts and prayers are with them right now, and also with the treatment team, those individuals in the healthcare that are the individual right now. Since the outbreak of Ebola in West Africa, Texas has been taking steps to make sure that we are prepared for an event like this. A lot of education has taken place. A lot of protocols have been put in place. We've developed the ability to test for this virus since August, and to be able to do that in our laboratory. And that preparedness is not just taking place at the state level, preparedness was taking place here at the local level in this hospital. They took it really seriously. They've been educating their staff. They've been putting their own protocols in place so that they were ready to care for any individual that showed up with Ebola. So we've been on the lookout for this. I had the opportunity today to spend time with the team and talk to the management team and hear how they have been preparing for a long time for this event. And then I had the opportunity to talk to the infection control practitioners and actually go onto the ward and see firsthand the work that they're doing. And I want to let you know they're doing a great job. They're providing compassionate care. They have a committed staff that are providing top-notch care, and are doing that in a safe environment. They have a whole ward that's dedicated to the care of this individual. They have a whole team of, again, professionals that are very competent caring for this individual and are doing it, as I noted, in a very safe, compassionate environment, providing excellent care. Now, obviously, this disease is scary to a large number of individuals, but I think some of the points that Dr. Frieden emphasized yesterday need to be restated. One of those statements that he said, and I want to reiterate, is that people cannot transmit this disease until they have symptoms. Okay? And so individuals that do not have symptoms are not going to transmit this disease to individuals. That chance of them transmitting it is zero. This virus is not transmitted by the air. It's not transmitted by the water. It is transmitted by direct contact with an individual, with their skin, or contact with blood or secretions or other bodily fluids. Or if there was a contaminated needle, then you could transmit this. But it's not going to be transmitted, again, through the air, through the casual contact with other individuals. I also want to make the case that this is not West Africa. This is a very sophisticated city, a very sophisticated hospital, and the dynamics are so significantly different than they are in East Africa, or excuse me, in West Africa, that the chances of it being spread are very, very, very small. And again, unless somebody has symptoms, it's not going to be spread to another individual. Our laboratory has been developing the ability to do this test. Since August, we've done the proficiency tests and have that ability to do that diagnostic test in our laboratory, and that ability is available to support the state of Texas. We do a rapid diagnostic test, a polymerase chain reaction, and again, the test yesterday, the controls worked as they were appropriately supposed to work, and the test was obviously positive. We take great care in our laboratory to inactivate the virus and to ensure that, again, our laboratory folks are safe, and it was done in a very safe manner. And we have a biothreat team that is specifically trained to handle these high-risk specimens. So a lot of work is taking place right now. A lot of investigation is taking place, identifying individuals. That the family has been identified, contact has been made, messages have been conveyed to them about how we need to approach the situation. And we will continue to work very closely with our federal partners at the CDC, our local partners with the Dallas County Health Department, with this hospital, with the Dallas city government, mayor and judge, thank you for being here today, and with this full support of the state of Texas to make sure that we protect Texans and that we provide the care that needs to be provided. Thank you.
David, thank you. And let me add to that, Mayor Rollins and to Judge Jenkins, thank you both. This is all hands on deck. We understand that, and we've got great local partners, and everyone has their marching orders and understand the importance of that good collaboration, that good partnering from the state right through our federal partners with the CDC. So with that, we'll open it up to those of you in the questions, and individuals on the podium here can respond. Mr. Lane? I beg your pardon? Sorry. Mark, why don't you?
We're categorizing his condition as serious but stable. A checklist was in place for Ebola in this hospital for several weeks, and Dr. Ed Goodman, to my right, had led the implementation of that. That checklist was utilized by the nurse who did ask that question. That nurse was part of a care team, and it was a complex care team taking care of him in the emergency department. Regretfully, that information was not fully communicated throughout the full team. And as a result, the full import of that information wasn't factored into the clinical decision making. The overall clinical presentation was not typical at that time yet for Ebola. So as the team assessed him, they felt clinically it was a low-grade common viral disease. That was the presentation. He volunteered that he had traveled from Africa in response to the nurse operating the checklist and asking that question.
So was there a break?
I can't answer that question because that's one piece of information that would be factored into the entire clinical picture. The clinicians did not factor it in, so it was not part of their decision making.
Why was West Africa, the year down from West Africa?
That's a question that's really not in my domain. We are carefully assessing that now, and that is being investigated, so we are investigating it. I can't give you specific information, but we will look very carefully at that.
Sir, would you not call that a misstep? Would you not?
I would call that not factoring all the information among the team that was present, so that all the information wasn't present as they made their clinical decision.
Is there a truth to the information that this...
That information was not obtained when the patient was in the emergency room.
But do you know that now?
Oh, I'm Dr. Mark Lester, and I'm an executive vice president with Texas Health Resources. I'm the zone clinical leader for the Southeast Zone in Texas Health Resources.
Are you reviewing the procedures?
Well, remember, it's unprotected exposure to the bodily fluids that constitutes an exposure. And so very carefully, and together with the CDC, we're investigating how many people that might be and how they might be monitored if that's so.
Does that mean nothing?
As I said, we are investigating that right now. Dr. Lakey.
Again, my name is David Lakey, the Commissioner of the Department of State Health Services. We're working very closely with the local health department on this. The local health department identified individuals starting on Monday. They have conveyed information related to how this disease can be spread and the need to have ongoing monitoring. They will be in daily contact with the family. If they do not follow those advices, that advice, then additional steps can be taken. But right now, we're working with the family to ensure that they do as we are advising them related to spread of the disease. Zachary, you want to talk?
Well, I just want to concur with Dr. Leahy said that we are working with the we have identified those family members, and we will, Dallas County, along with County Judge Jenkins, we will take responsibility for monitoring these families, and our staff will be responsible for ensuring that they do not get out into the public. So that's a task that we're taking on, and we support Presbyterian Hospital, the governor, and Dr. Leahy, and the CDC in this response. Well, we want to make sure it's clear. It's going to be monitored by our staff. As Dr. Leahy pointed out, if they don't follow our recommendation, more stringent guidelines will be put in place, and that's something we need to discuss in a more legal aspect.
What assurance
All the information says that the patient did not have, and actually not until many days after his arrival did he start having any symptoms of fever, etc. That is from him.
so we don't know.
He had screening before he got on the airplane. There was no screening. You don't screen afterwards. There isn't additional information besides the information that we got from the individual. Dr. Goodman, did you?
I think that's Dr. Creed.
The hospital's looking at that right now. They've identified the individuals that had contact with the patient, identifying what that contact was. Just because they were in the emergency room doesn't mean that they had contact with the individual. Discussions are taking place with those individuals to see what kind of personal protective equipment they used in that when they were evaluating those individuals, and so all that is being discussed right now, and that's why the CDC. Does anybody from the? None?
I'm Dr. Edward Goodman. I'm the hospital epidemiologist. I'm an infectious disease specialist by background and training. Let me emphasize that when the patient arrived on Sunday, the 28th of he was recognized as a possible case. He was placed in the appropriate isolation, so there was no further exposures from Sunday morning on. Exposure is not the same. Contact and exposure are not the same. The people were wearing appropriate personal protective equipment. The questioning of the healthcare workers who saw him 2 days earlier started before we were proven to be, before it was proven to be Ebola. So those questions have been ongoing. Since his arrival on Friday, he was not vomiting or having diarrhea, and therefore there was no exposures. So we really think there is very little likelihood that any healthcare worker exposed on Friday, and certainly virtually zero exposure starting Sunday. Just fever and some abdominal pain. The test for Ebola virus that is used is a highly sensitive measurement of virus in the blood. Dr. Lake is called polymerase chain reaction. In the first 3 to 4 days of symptoms, the level of viremia is quite low, and the test is not always positive. But in the case of a patient who's been sick, by the time we saw him for probably 5 or 6 days, the test should be essentially 100% accurate. I'm sorry, we didn't have those conversations. Oh, yes, thank you, Governor.
Dr. Goodman.
I can't answer your questions.
We did not discuss that specific question. What we did talk about was that the CDC has the largest stand up outside of the United States in their history. I think some 130 CDC personnel that are in Africa now. Yeah, obviously we have a very large contingent of our military there. And again, I think this goes to the heart of finding the solution to this issue both globally and for the United States, is for our participation in that, the United States engagement in that, and for us to assist those countries in Africa. With that said, I'm very confident that what is ongoing now, what Mayor Rollins and Judge Jenkins and their team are engaged with here, both on the private sector side and then what Dr. Goodman and the folks at Presby are engaged with in the treatment of this patient and of the protection, the isolation, the appropriate effect of our healthcare professionals. There is no place in the world, I will suggest to you, that has better professionals, better ability to address this than in Texas. We wish it were somewhere else, but the fact is it's here, and we have an extraordinary team of men and women passionately and compassionately delivering care to this individual and doing everything possible to make sure that the citizens of the state are fully protected from this virus. I'm confident that the work that they're doing is appropriate, and we will keep our citizens as safe as possible. Thank you all for coming and being with us.
Superintendent Miles, can you take the stand?
Okay, I'm Sana Sayed, Public Information Officer for the City of Dallas. We are going to have our local officials to answer any questions that you might have. We have County Judge Clay Jenkins here, Mayor Mike Rawlings, Superintendent Mike Miles. We also have Chief Seals with Dallas Fire Rescue.
Let me say something real fast and then get Mike Miles up here because he's got some important information for families. The fact that Mark would answer all those questions and get you all that information, and that Mike is about to give you this information about schools should let you know, and just like you know from past the West Nile virus and other things, we're going to be transparent with you. There are no perfect responses, but thus far the CDC is describing this as a textbook response, and we have the things in place. Zach's department, Chris's department, working with the CDC, have done everything that the CDC has asked to be done since this case got there. Presby's doing an outstanding job, and this is a safe, good hospital to come to. Mike has we'll take, Mike Rawlings and I will stand here and take your questions until you're tired of asking them. And here's Mike Miles to give you some pertinent information.
Just to reiterate, you know that safety of our students, our parents and our community is number one priority. And so the thing, I think at this point, we have every confidence with CDC. We have a good team. We've been talking this morning to ensure that we keep the confidence of the community high, but also the safety of our kids paramount. In that light, we'll take some steps to try to ensure that. Number one is information. Right? The reason why we're having this press conference right now is to provide as much information to the community as possible. We want to make sure our parents are informed. But in an abundance of caution, we're taking some other steps too. We have the 5 students who attend 4 different schools in Dallas ISD. Those schools are Conrad High School, Tasby Middle School, Dandy Rogers Elementary School, and Hotchkiss Elementary School. Just want to make sure I got that right. And then you probably know that there's another elementary school that's close to Tasby Middle School. It's just across the way, and that's Jack Lowe Elementary School. What we're doing, and we've already informed our staff, we'll be obviously notifying our parents. That the students didn't have any symptoms, and so the odds of them of passing on any sort of virus is very low. But we're also going to be staffing those schools with additional health professionals. We think, again, we have full confidence in CDC that it's contained, but just to lay fears, additional health professionals will be on hand to answer questions, to check any flu-like symptoms or any other symptoms that kids might have going forward in the next couple weeks. We also will have an additional custodial staff. So we have cleaning the buildings every day, but we're going to add custodial staff to those buildings. It's not a hardy virus, and so regular disinfectants is going to help should there be anything in the school buildings. And so we'll have additional custodial staff on hand doing what we did with the West Nile, what we did with the avian flu, those sorts of things. And then finally, we'll continue to monitor. We're going to work with our partners here and continue to provide our parents and the community with information and be on hand to answer any questions that our students or parents might have. We're going to keep going business as usual. School will be in session today and tomorrow and into the future.
Go ahead. Keep it.
Yes. Tasby Middle School. Tasby Middle School. Tasby. Conrad High School. Hotchkiss Elementary School. Jack Lowe Elementary School. And Dandy Rogers Elementary School. Dandy Rogers. We were informed this morning by the Dallas County Health and Human Services that these 5 students could possibly have been in contact with the patient at the home over the weekend.
We're told that the patient
They had contact with, they possibly had contact with the patient over the weekend, and they have been in school since then. We've been told that they have no symptoms no symptoms of any health problems. They're at home. I'm sorry? Well, they're being monitored by Dallas County Health and Human Services, and that's not the same thing as quarantine.
how long?
That will be up to Dallas County Health Department and CDC, but it'll probably be 21 days. Yeah. Quarantine.
So we're going to be working on an evolving basis with the CDC and our partners in Washington to make sure, both in Atlanta and in Washington, to make sure that we handle the boots on the ground aspect of what they're requesting appropriately. Dallas County Health employees will be those boots on the ground monitors. Quarantine connotates people in a plastic bubble room, unable to get out, and that is not the situation here. We have situations where we have children that are being asked to stay home. We're having people monitor those children. It is an evolving process, but it's a complex process because you've got a neighborhood where 33 languages are spoken. 25,000 people live there. We don't want to panic the neighborhood. We don't want to run people underground, so to speak, as we do this. So we're trying to do this in a very thoughtful way. But what you need to know, and Zach can answer some questions about exactly what's been done so far, what you need to know is that we are doing, for example, my last email from the White House about this was at 3:07 last night. My first phone call from Dr. Frieden's office was at 6:50, or I guess they're both this morning. We're 3 hours apart, so you can see we're not getting a lot of sleep, but we're all working very hard, and people are focused on this, and they're going to be monitored in such a way that the public can be assured you're going to be safe. this virus is isolated, is being contained, will be contained, and people needed to, if they exhibit symptoms of Ebola, which you can find on our website or the CDC's website, certainly get checked out. But we don't need people. We need people to remain calm and do what Dallas County people are good at. We are good. Mayor Rawlings, Zach, the Frank Obama's team, and the CDC's team, and Dr. Frieden. We're good at keeping you safe, and you're good at staying calm and working through these things. And this will be one of those times when the people of Dallas will shine, and we'll get this job done. And people need not panic, and they need not stop coming to Presbyterian while this person is getting care here, because we don't want to clog up all the emergency rooms. There is no danger to you to use Presbyterian Hospital for your medical needs. This is a great hospital, and there's absolutely zero chance that you can be infected by Ebola by simply going into a building where a person is under isolation.
We've only just sent out the notice, so I don't know. Yeah, the students were in school earlier this week.
Yeah. Go ahead, Jack. Jack. What? Go Jack. Go ahead, Jack.
Mm-hmm. Yeah, I can't confirm that, and I will tell you that the executives at DFW have looked at the flights and examined exactly what happened at that time, and feel that there was zero chance of anyone getting contaminated. Furthermore, our staff is working closely with CDC to create a protocol and some process and disciplines if in fact anyone shows up at customs that the customs officials feel that we need to look at. So there's a whole process that folks have been trained on, and we're prepared on that. I want to say this, just a couple of things though that I think it's important, because you are all intelligent, okay? The science says that if you are not exhibiting symptoms of this, there is zero chance that you can transmit this. Not minuscule, zero chance. I asked that question earlier. If you want to do what's good by your viewers, you will tell them it's zero chance. If everybody thinks of it, then they're going to act in a different way. Now, we are prepared at the city. We've created an emergency operations center. We're training all our 911 folks, or 311 folks, to answer all the questions, so there's going to be tremendous transparency there. Our fire department have already retrained the paramedics. Great story is they had trained them on this, and that's why we feel very safe about those paramedics, because they knew that somebody was from Africa and was exhibiting these things. And we're creating a communication plan to work with Councilman Gates, who this is her district, and the county, to make sure that all the information gets to every house. We have reverse 911 calls going out to communicate this, so a massive communication process to educate people on the facts, not the rumors. Thank you very much.
I'm Dr. Christopher Perkins, Health Authority Medical Director for Dallas County Health and Human Services. To answer that question, we have done contact investigations in relationship to this particular patient, and those close contacts, they're being monitored as far as symptoms, as far as measuring their fever, to see if they're developing a fever. This is going on a daily basis. We are actually the boots on the ground that are actually putting our eyes and our into the. We're talking about the close family members, so they could be children as well as other adults. Right now, as far as the immediate household, we're talking about 5. Well, keep in mind now, this is concentric circle, so what we have to keep in mind that this is an immediate household, but we have other family members, okay? So in regards to anybody else that might have come in contact with this person, there's a patient here. So what I'm saying to you, now we're talking about around between 12 and 18 patients, 18 contacts, excuse me. Contacts I'm talking about. Beg pardon? Well, initially we're talking about the children. We're actually monitoring them. As far as the adults, they can do self-monitoring. So we're expanding our investigation as far as contacts with CDC and the State Department of Health Services. In regards to monitoring them, we're talking about 21 days of observation. As far as the children, we're talking about them not going to school. As far as the ongoing investigation, we'll provide updates when we decide along with the CDC what the appropriate protocol. This is not a quarantine. Okay. That at this time, we're not aware of that, but like I said, this investigation is ongoing, so we'll provide updates when we have that knowledge.
Let's go back to your question real fast. If the CDC says that they're not to leave their home, then we'll work on that. We are the boots on the ground. I'm not a doctor. Zach's not a doctor. Chris is a doctor. We are talking to the best doctors in the world at preventing the spread of disease. The Center for Disease Control is doing the protocol, and we're effectuating it. If they change the protocol, we'll follow that protocol. We're in regular communication. I've had my phone in my hand because Dr. Frieden is texting me and said, I need to call you soon. So, I mean, it's, nobody's shown any symptoms. That's a HIPAA deal. I mean, I think y'all probably had that from the Liberian ambassador, as I understand it, but we're not going to answer that question. Yeah. I personally I don't believe we have that information. Let me, say this, and I hope you don't, take it the wrong way. I mean, that'll come out. We're under HIPAA, so we're going to be very limited to give you personal information about people. It doesn't matter to Dallas County if someone is from Pluto, okay? We're going to do everything in our power to help that person and help their families and help the people who are here and keep this community safe. Keep all of you, whoever you are, wherever you are in Dallas County, safe. Yeah. I think maybe the CDC or Chris should answer that. I do know there are two. There's it's the strain that's in West Africa, but you'll let a doctor. You want me to answer that? Well, I was listening to this one. What were you saying, Robbie? Who's asking? Look. Zach.
Dr. Perkins and our EPI staff, along with the CDC, is focused right now on those family members, and we're looking for any other close contacts. So that's where we are in this investigation right now. The good part about this is that we have more boots on the ground with the CDC. And so with their EPI team, we're able to look at any additional contacts that may come up. But right now, we're focused on the family, any close contacts, and so that's been done.
You know, this man hasn't spoken. Thank you.
We will have people, and tell you that we will also have additional people who understand that neighborhood and can help, especially with the languages. And so we'll have additional people to answer questions, and we'll judge the need with regard to a town hall meeting. But the information we've already put out, we'll continue to keep people updated so that they have the latest information that they need. Mm-hmm. No, we're talking about people at this school.
And others that go door to door. Yeah. Let me say this about town hall meetings, right? Town hall meetings are an opportunity for crazy people to scream at one another, okay? And what we need right now is an opportunity to get information to people who need information. I'm not afraid, okay? Jennifer Staubach Gates, Mike Miles, Mike Rollins, we're not afraid that if we go talk to the next door neighbor of this person that we're going to get Ebola, because we understand what science is, and we understand we have a 0 chance of getting that from that next door neighbor. And we're going to go reassure, or at least, some of us as time permits, we're going to go reassure, and so are our employees, face to face, in close proximity to them, that they're okay. Because that's one of the best ways that we can illustrate to all of you that you are going to be okay. We're doing what we need to do to keep you safe. And we would not be exposing our own family to the Ebola virus if it were not as we say it is. And that's why we're going to go talk to those people who are from many different countries, who speak 33 different languages, and some of whom are going to be very afraid if this is not handled in a way that allows them to get accurate information without people panicking them with misinformation.
Last question.
Good.
We had a training in August. Zach's department, Dr. Wendy Chung, our chief epidemiologist there, got a lot of information out to our hospitals and got them ready in August in case we had a Ebola case here. And lo and behold, we are the first one in America to have one here. But the Dr. Goodman was just telling me in the men's room before we came in here how pleased and proud he was of the work that Wendy Chung had done to get people ready for this. And our hospitals are doing a good job. I was on the phone last night with the CEO of Parkland and the top medical doc at Parkland about what we're doing at our hospital. And they're doing a tremendous job. It's like I told you when I first stood up here, there is no perfect response. There's no perfect response. This is a textbook response. We can examine our navels for a week about what happened on September 26th at a great hospital, or we can move forward and protect our citizens. And what Mayor Rollins and I choose to do, and what the President and the CDC choose to do, and the Governor's choosing to do, is we're going to move forward and keep people safe. And as information comes out, we're going to share it with you because you're our partner. You are going to help us get the important information out to the public. If we make a mistake, you're going to get to ask us about that, and we're going to have to own that. But right now, I did say I would stay here for as long as you have questions. You guys have a lot more questions than I thought you probably would. But I want to get out of that neighborhood. And I got about 1,000 other things to do too. But just know this, We are working long hours. You know, nobody is sleeping regular hours until this crisis is over, and you, the people of Dallas County, are safe and are going to remain safe.
Thank you very much.
Thank you.
Appreciate it, guys.